Hi, I'm Dr. Myrna Lazaga here in San Diego, California. We have a lot of questions that we receive regarding tooth pain, and I'm going to answer those common questions so to help you better understand what causing the or hurting your tooth or your teeth. How can you stop tooth pain fast? One that you can do is take pain medication like Tylenol or Motrin. But you can also use some ice. But the best thing is to call your dentist and set up an appointment. That's the fastest way to relieve tooth pain. The longest solution of tooth pain is when we are able to find out what's causing the pain. And the only way we could is use to call and see your dentist so that way they can do an exam, an x-rays, and find out what's causing the pain, and there will be appropriate solution for that. That's the one thing that would be long-term, because if you just be taking pain medication, it's just a temporary relief, but it does not solve the problem or the cause of the tooth pain. The most common reason for a tooth pain is number one is infection. And dentists can find it out by doing the exam and doing x-rays. With that, we will be able to tell if there's an infection, which is a common cause of dental pain or toothache. So best way is to see your dentist. A lot of common that will trigger pain that's not teeth related is when you have your muscle is sore, like let's say you keep chewing or clenching, or you grind your teeth at night. Next thing you know, your jaw is hurting, or the muscles there, you're having what we call muscle spasm, where it's hard to open your mouth, and you sometimes even have like an earache pain as well. And then sometimes it triggers as well getting headache along with it. Another thing that's most common is when you have colds and your sinus, you have congestion, your sinus is, if you have sinusitis, that could also cause pain. You might be experiencing dull toothache in a lot of reasons. One is maybe your bite is high, or maybe you've been grinding too much that you're pretty much beating up your teeth. And then the other thing, there might be root fracture, or you might have gum infection that the food get trapped in there and your gums is inflamed or infected. What should you do with pain or unbearable toothache or tooth pain? First thing that you need to do is call your dentist. And if not, your dentist is not available, you can go see in an emergency room. But best way is your dentist, because I have a patient that told me that he been to an emergency and they even give him morphine, and it did not do a thing. So when he was seen at the office, that's when he told us that he got relief, and that's what he went through. It should not be a normal that you'll experience pain, because most of the time when you're in pain, you end up having relief. Let's say, for example, you have a toothache and we did something with it, we will be able to give you relief. If there's a swelling, we will be able to reduce the swelling. And if it is like in pain, we will be able to relieve you from pain. But if any procedure that might have caused maybe discomfort but not pain, I should say, and also it should be maybe sensitivity when you have fillings, because I see it that when anything we do with the tooth, the nerves or the brain interpret it as a trauma. So even though we're fixing your tooth, the sensory nerve you have, it will send message to the brain saying that, hey, trauma, trauma, trauma. But actually, what we did is fix your tooth. So you can experience discomfort, I should say, more or less, but not pain. When you are experiencing pain around implant, you have to go see your dentist. So as when you have pain underneath your bridge or underneath your dentures. One is there could be an infection in those areas. And if you have a denture that's special, it's removable, there you might have sore spot in that area. But also, you need to see as well, and we will check as well as your bite. That could also be another source of pain. There are many home remedy that we can do at home. One is, of course, take pain medication. Two, apply cold. And three, make sure do you clean that area, brush and floss. There might be some food that get trapped in there, and that's what causing your gums to swell up. And rinse with warm salt water, about 1 teaspoon of salt to a cup of warm water. And take rest as well. A dentist is the best person that could help you find the permanent solution for any tooth pain or toothache. Because with that, we will find out what causing the toothache or tooth pain. Because anything that you do at home or even the pain medication is just a temporary relief. It's still not the final solution. You are just, it's kind of like you're having a big wound and you're just putting a band-aid on it, but you're not treating what's causing or the big wound, appropriate treatment for that. Same thing, the dentist would be the best person to help you what's the necessary treatment for the tooth pain that you're having. The sooner the better to treat the tooth pain and set up an appointment so that way we can get it treated right away because, once you have a cavity or decay, it doesn't get better. So I'm hoping that with that we still can save your tooth or teeth in that case. When you have tooth pain, there's some procedure that we can have to get you out of pain, but at the same time, save the tooth. I hope that I have answered most of the questions you have. But if you have any further questions or more questions, please call our office to set up an appointment at 619-477-0570. We're here to help you.